Good afternoon, everyone. Thanks for joining us. Hope you had a good weekend. Would like to give you a quick update on some of our COVID-related information. We now have had 505 of our neighbors lose their lives to this virus, 505 fatalities. We are now monitoring 608 active cases. Now, this is similar to the number of cases we monitored about a month ago. Now, over the last month, October 10th to November 6th, the largest amount of new cases are occurring and continue to be occurring in the 10 to 19 years of age group. That's 16% of new cases, followed by those who are 30 to 39 years of age and 40 to 49 years of age, and they each represent 15% of the new cases we've identified over the last 30 days. Of those interviewed and reporting to us, 72% of new cases are among those who have not been fully vaccinated. I offer that as information. It's useful to us to know what we're seeing as far as data. We're averaging 2,059 tests per day. That's the average of the last 7 days. And we're seeing 63 new cases daily in the last 7 days. Now, this has been increasing slightly. Would like to be below 50 new cases per day. And next, we'd like to be below or at 1% positivity, but we are at 2.95% positivity rate. Now, we've been under 3% for the last month, but we'd like to see that number come down even further. We're monitoring 17 individuals who are hospitalized. Now, again, this is an indicator that's important because we believe at this level the concern is being able to provide appropriate health care to those who become ill. If the severity of cases is down and the number of hospitalizations are down, then it is, again, while we might see positive cases, it is a controlled public health risk, if you will. So from our perspective, 17 hospitalizations is a lagging indicator, but we're still at 17 and have been below 30 for over a month. Now, the hospital demographic information, several have asked for this, and I'd like to update you. So we have a 14-day average. Of that 14-day average, we've seen 17 patients per day on average. 72% of those hospitalized are partially or not vaccinated at all, and 28% are fully vaccinated. Now, of those hospitalized, we have had no one in the age category of 0 to 18 years of age. So under 18, no hospitalizations in the last 14-day average. We have 5% of our hospitalizations are among those 19 to 44 years of age, 32% among those 45 to 64, and 63% among those 65 years of age and older. In the vaccination demographic area, we are now at 79.6% of all adults in Dutchess County have received at least one of their doses, and the highest vaccination rates are among those 55 years of age and older. In fact, we have seen between 87 and 99% vaccination rates among those older than 55 years of age, and posing, in many cases, the higher degree of vulnerability. In those aged 12 to 15, 58.8% have been vaccinated. They're receiving at least one of their doses. While those under 12 years of age, 5 to 11, now qualify for the Pfizer vaccine, that data is not yet readily available, but nearly 60% among those 12 to 15 years of age, and again, nearly 80% among those adults. We are continuing to partner on clinics, so if you're still interested in receiving your vaccine, again, we'd like you to consult your physician, make those choices as you feel best for you. Those clinics are still available. We continue to host Monday through Friday, 9 a.m. to 5 p.m. at the Family Partnership Center in the city of Poughkeepsie. The former JCPenney's at the Poughkeepsie Galleria is open every Thursday from 4 to 7 p.m., every Saturday from 9 to noon. Now, on Thursdays from 4 to 7, the Johnson & Johnson and Pfizer doses are available. Every Saturday, Again, 9 to noon, the Johnson & Johnson and Moderna shots are available. They will be closed the week of Thanksgiving. So Thanksgiving week, those vaccine clinics will be closed. And, of course, these are walk-in, or you can pre-register. And if you have information, visit duchessny.gov/COVID vaccine for more information. Testing is available. Again, you might choose to be tested because you're going off on a trip or vacation or accessing some activity that may require it. You may be mandated by some employer to be tested. If you are and you'd like to have access to the open clinics, that is available. We are at the JCPenney's, former JCPenney's, in the Poughkeepsie Galleria on Tuesdays, 3 to 7 p.m., on Thursdays, 3 to 7 p.m., and on Saturdays, 9 to noon. And again, those are free testing opportunities, and we partner with ProPhase Labs to provide that to residents. Thanksgiving week, they'll be closed on Thursday, but they'll be open on Monday. So closed on Thursday for Thanksgiving, open on Monday, 3 to 7 p.m. And these are the lower nasal PCR and the saliva-based tests, and again, they're free to individuals. We'd ask you to pre-register if you can at duchessny.gov. As you may have heard, the CDC is supporting, and the Department of Health in the state, the New York State Department of Health, supporting both testing out of quarantine for those who are contacts and what's referred to as test to stay for schools. Let's talk a little bit about testing out of quarantine. So this is an option that shortens the quarantine for contacts of a positive case. So if you actually have tested positive, there is still the standard quarantine requirement, but this is for those who are contacts of those who test positive. And again, if you've been vaccinated, there is no quarantine requirement under the CDC and New York State Department of Health requirements. This only applies to those who have yet to be vaccinated, who are in contact with someone who tests positive. Good example is a school child, but nevertheless, if you're a contact of a positive, based on the CDC guidance and the New York State Department of Health authorization, a local health department like ours can opt to impose the test out of quarantine. In essence, an option to cut down on the mandatory, the New York State Department of Health mandated quarantine period. We have chosen to do that. Ask you to be a little patient with us as we enhance our logistics to make this happen as effectively as possible. But if you are a contact of an individual who tests positive, you can end that quarantine with a negative COVID-19 test that would occur on day 5 or later and have no further symptoms. So someone you've come into contact with has tested positive. Remember, if you're listening, for anyone, simply coming into contact with someone who tests positive does not make you a quarantined positive. It's if you have come into close proximity to that individual for an extended period of time, generally within 6 feet, 15 minutes or more. Although, again, the CDC has altered some of these things, could be within 3 feet for a period of time. But again, simply being in a room or in a school class with someone who may have tested positive does not make you a contact. If you come into close proximity to an individual test positive, you are, for a period of time, you're considered a contact. You would be required to quarantine. You can reduce that quarantine to 7 days if on day 5 or later you test negative and have no symptoms. End the quarantine, get back to business. Alternatively, if you choose not to be tested at all, that quarantine would continue for 10 total days. The negative test must be submitted to the Department of Health, and you'll receive a release from that quarantine requirement. So, just important to know that this option is available to everyone, general public, not just those in school settings. However, test to stay is specific to school settings, and again, this is an option a school district can choose to implement. The County of Dutchess definitely accepts this as a way of keeping kids in classrooms, and we're seeing it happen in parts of the county today. So an option under the CDC guidance and the New York State Department of Health rules is that a county can authorize tests to stay to allow students and teachers who are not yet vaccinated to test and remain in school following the contact with a positive case. Come into contact with somebody who tests positive, again, may be required to quarantine. However, in the county, School districts can choose. It is up to the school district, but we support if they wish to choose. I read a school superintendent suggested that we were sort of just putting this all on them. If the school district doesn't want to do this, it is their right not to. If it is something they wish to do, testing becomes available. Close contact. So an individual who is a close contact can undergo a daily test for 7 days following the exposure, and if negative, remain in school. If they're positive, then they would have to isolate. So individual child comes into contact with, again, unvaccinated with a positive case. They can test daily, have a negative test daily, and continue to go to school if they have no symptoms and test negative. They stay in school. If they're positive, then they would have to isolate. And in this case, the testing is covered by federal grant dollars that were secured for school districts. The Wappinger Central School District, for instance, is one that has started early with this, and they are identifying it as very effective. And they are both identifying individuals that ordinarily under the quarantine requirements would be sent home, and thankfully they're remaining in school. Again, that's an option that you, as an individual, parent for their children, and the school district can choose. We are certainly allowing it as a means of keeping kids in the classroom. Now, you likely know that the FDA has approved the Pfizer vaccine for those who are age 5 to 11 years. This is a separate vaccine formulation, so as you probably know, it is a lesser dosage and, in case you wanted to know, a smaller needle for young people 5 to 11. This is the Pfizer shot. Now, the Pfizer is currently the only brand that's approved for ages 12 to 17. In that category, 12 to 17 receive an adult dose, 5 to 11 receive a lesser dose. And again, my recommendation to you is to do what you think is best for your child. Consult your physician, your pediatrician, and make the decision, make the choice that you feel is best for you. I believe that is the most appropriate. Get your medical advice from your physician and make the decision that works for you and your child. Now, there is availability to this vaccine for those who are aged 5 to 11. Dutchess County is partnering with pediatric groups. Caremount Medical Group, for instance, is open to all patients and non-patients. So if you don't have a Caremount physician but would like to access a vaccine through the Caremount locations, they are in Fishkill, Poughkeepsie, and Kingston 5 days a week. And there are partnerships with other pediatric groups in Dutchess County, including the Children's Medical Group, Sun River Health, which is a federal health clinic, Bambini Pediatrics, and Premier Pediatrics. In those cases, Children's Medical Group, Bambini, and Premier, they are accepting and administering the vaccine to their patients. And again, if you are without a physician or a pediatrician would like access, Caremount is providing access to non-patients as well. Now, additionally, there are pharmacies, the big ones, as you likely know, CVS, Rite Aid, Walgreens, and others who have access to the vaccine. Pharmacies locally that are participating are the Pine Plains Pharmacy, the Medicine Shop in Fishkill, the Beekman Pharmacy, and then again those larger chains. And I do want to give a shout out to the Pine Plains Pharmacy, the Medicine Shop in Fishkill, and Beekman Pharmacy. They, among other small businesses, have been very helpful in partnering over the last 20 months. But again, just as I would, I think you make those choices with their best be made with your physician, with your pediatrician, and in whatever you feel is best for you and your children. We are continuing to provide access to vaccines at several school-based clinics. This is a partnership that is available at the Beekman. Last week at the Beacon Middle School. Tonight from 4 to 7 p.m. at the Dover Middle and High School. The Poughkeepsie Galleria, the former JCPenney site, on Tuesday, November 16th from 4 to 7:30 p.m. and on November 30th from 4 to 7 p.m. at Stissing Mountain High School in the town of Pine Plains. That's what we have for this week. We'll try to keep you updated. If there's any new information to share with you, we'll be certainly able to do that. If you have any questions, please feel free to reach out to duchessny.gov. Visit duchessny.gov. In the meantime, stay strong, keep healthy, and be kind to each other.